Good morning, class, and welcome to Physiology 998. My name is Dr. Guillermo and I will be your instructor this semester. Please introduce yourself to the class.
My name is Victor Miranda.
So before this semester, I actually had the pleasure of working with Dr. Mike Connor in her drug discovery lab. As our first lecture today, we'll be focusing on neurodegenerative diseases.
So what are neurodegenerative diseases?
Okay. So great question. Neurodegenerative diseases are actually classified by the death of neurons in both the brain and the spinal cord. What makes these cells so unique is that they are unable to be reproduced once they are alive. So once they die, their damage is actually irreparable.
So what diseases does the Connor lab focus on?
So the Connor lab mainly focuses on ALS, Alzheimer's, and a very rare disease known as pontocerebellar hypoplasia type 1. There is currently no known cure to treat these diseases.
I'm also aware that there's not only a lack of treatment for these diseases, but the cause isn't very well understood.
So you're absolutely right. With a lack of cures currently available, the vast majority of people currently suffer of these diseases. In the United States alone, nearly 6 million people currently suffer. As a guiding question, you're prepared to answer the following for your final report. In what ways can neurodegenerative diseases be treated using new techniques? Alright class, be prepared to present your final reports. We'll be starting off with Victor.
So the typical pipeline of drug discovery follows this diagram. It starts off with screening of molecules using cellular and out-of-cellular environments, testing them in animals, and finally, clinical trials in humans.
So what are traditional targets with drugs in the current market today?
So many of the traditional drugs target proteins, and the reason why they target proteins is that they do most of the cellular work.
Are proteins the only target that can be used?
No, however, very little work has been done to determine whether other biomolecules can be used as drug targets. Previously, it was thought that RNA was only a messenger biomolecule that served as a link between DNA to protein, and protein would do all the cellular work.
So how did you test to see if RNA was a good candidate?
I started off with computer simulations, and if these were successful, I moved on to physical characterization in the lab, where I was able to purify that RNA and then test it with small molecules.
Now, I do have a few more questions I'd like to ask. How can we streamline the in silico targeting process so that we can get drugs approved faster? And how does our day-to-day work improve the lives of those who do have neurodegenerative diseases?
So my two remaining questions are, why do some drug candidates work really well in the animal testing, but as soon as they enter human trials, they fail? My other question is that many disease models use knockdowns or activators of genes to mimic the disease, and is it possible for us to use these same techniques using small molecules?